Good afternoon, everyone, and welcome. Thank you for joining us today for a conversation on hidden costs in the workspace. I'm Ishita, and I'll be moderating this session. Today, we're going to unpack something every GCC and HR leader is quietly grappling with: why workforce wellness investments aren't translating into the outcomes they're supposed to. So, to take us through this, I'm joined by two people who will look at this problem from very different vantage points. Okay, so we have with us Sateesh Hegde, who brings over 2 decades of experience in the business space. All right, so he has worked with HR leaders, experience across GCCs, spanning engineering, services, IT, manufacturing, retail, you name it, and he knows it, right? He's also held total rewards leadership roles as well, and has a very strong ground understanding of the health and wellness domain from the employer's perspective. All right. Now, to counter that, we have Debasree, who is a health coach with over 12 years of experience in the corporate health domain. She works very closely with organizations on what actually moves the needle when it comes to employee well being. All right. So this time we've structured this as a conversation between Sateesh, who will be pushing back and asking some hard questions that HR leaders are actually asking. And Debasree is going to respond with what the evidence actually shows. Okay. So I'm just going to step in periodically so that we keep a tight track of time. All right. So over to you, Sateesh.
Thank you, Ishita. I'm really excited. So my name is Sateesh Hegde. So Ishita has already given a very a long introduction. So let me give a brief introduction. So my name is Sateesh. So I carry 2 decades of experience of working with various HR heads and heads of total rewards. And my expertise is more of in wellness, especially in GCCs. So today, I am actually representing the HR heads and head total rewards function in any GCCs. Uh, Today, my questions are not my questions. It's the questions from the ground, the real questions asked by HR heads. Over to you.
Hi, everyone. Thank you so much, Ishita, for the warm welcome. My name is Debasree Nandy, and I am a nutritionist, and also I'm heading the India operations for HabitNu. I'm pretty excited today to answer all the questions that Sateesh has. And yeah, let's begin.
Yeah, definitely. Debasree, so whenever I go and meet, total rewards heads or total reward managers or even HR heads, so, there are a couple of questions come again and again. Okay.
Yep.
So let me start with the total rewards function or, the manager total rewards.
Yeah.
See, their pain area, especially with respect to wellness, is about increase in insurance claims and increase in insurance premium.
Absolutely.
See, inside the organizations, we also have to understand that they have to get the approval from CFO before investing a wellness program. Say, they always say, Sateesh, we do have a wellness program. Okay. For the last 4 years, we have been conducting wellness program in our organization. But my problem is, my insurance claim is increasing, my insurance premium is increasing rather than decreasing.
Yeah.
So that is my first question. As I mentioned, these are not Sateesh's questions, these are the questions from the ground, from the practical perspective.
Yeah.
The second perspective or the persona is CHROs or Vice President HR or Human Resource Development heads, you can say. Their perspective is a bit different. They look at this wellness program in a different angle. So they also say the same thing, almost similar. Sateesh, we do have wellness programs, okay, but my productivity is not really increasing in the sense, it's a question of ROI. It's a question of return on investment.
Yes.
Right? My productivity is not increasing.
Correct.
My absenteeism is not really decreasing.
Yeah.
Okay, but what is the fun in having a wellness program? So these are the two hard questions. So I get. So I think since you have worked with so many organizations, especially in wellness programs, please.
So thank you so much, Sateesh, for that question. And I think it's a very valid question from any HR leaders for that matter. So most organizations measure what is easy to measure. That is like attendance, engagement, annual health checkup participation, and also the other things like gym subscription, like
Correct.
if they are taking, or if you're providing, your wellness vendor providing is gym subscription, if they are the turning up count is high or not. But the performance doesn't really decline in a straight line.
Mhm.
It just drifts. So
Mhm.
the earliest warning signals are usually invisible.
Mhm.
And we have to understand why it happens. So employees begin experiencing chronic stress, poor sleep, fatigue, and also emotional exhaustion, metabolic changes, and also reduced focus. So none of these immediately appear on an HR dashboard. So
Mhm.
on an HR dashboard, we are tracking their absenteeism, correct?
Mhm.
If they're absent.
Mhm.
But the thing is, it's not about only absenteeism that is affecting the business, but the presenteeism.
Wait. What is that presenteeism? I mean, I have
Yes.
heard of absenteeism. Debasree, absenteeism is like employees not really
Yes.
turning up for the job.
Yeah.
They may or may not apply leave as
Yes.
well. But what is this presenteeism?
So I was expecting this because absenteeism is more, it's relevant.
Yeah.
But presenteeism is something nobody talks about. So the
Mhm.
presenteeism is nothing but when employees are physically present.
Mhm.
They are physically present to your office,
Mhm.
but mentally exhausted.
Okay.
They are attending meetings, they are responding to all the emails. Working hours are very long, but they're producing far less than they are capable of.
Mhm.
So the work from home requests are increasing, they are taking leaves. So that is different. Again, absenteeism is different, but the presenteeism, like when they are at office, but the productivity is less,
Okay.
that is costing more.
Okay.
Because and they are already paying for them through lost productivity, replacement hiring, rising insurance premiums that you have mentioned, and disengagement. So, and that's where the real business get affected.
Okay. So, uh, you mean to say that the existing wellness program
Yes,
are not very specific? That's what I think you are coming from.
correct.
Uh, you may be right because you are right. Sorry, you are right.
Yeah.
See, we have heard of this Pareto principle. There is something called Pareto's principle, 20-80, right? So basically what happens is 20% of my employees, they contribute to 80% of the claims, insurance claims, or even they are the chronic absentees.
Yeah.
In
Yeah.
fact,
Yeah.
they contribute lot towards the cost. So you added presenteeism as well. So maybe I'm very sure if I am having the chronic illness or maybe metabolic health risk, I usually come to office and maybe spend, I mean, not actually doing work. So if that is the scenario, that is the scenario, what is the model you are basically suggesting? Or from the wellness vendor, if at all I have to, being HR man, being HR head, from the wellness vendor, what are the questions I have to ask, so that what are the checklists, 1 2 3 4 5 6, so that I can get a proper program design.
Okay.
Right. Yeah, please.
Before you ask me, I want to ask you back.
Okay, please.
What are the things that you do or you ask when you are choosing your wellness vendor?
Okay, awesome. I mean, this is a good question. Great question. Let me think. Okay, let me let me pause and think, and then answer your question. In majority of the cases, in 99% of the cases, how HR heads, as I mentioned, I am representing HR heads, CHRO today.
Yeah.
And based on my experience of speaking with so many hundreds of HRs, how it happens in 99% of the cases is that, usually the app, the
Yeah.
mobile app will be given to, say, I'm a GCC head, CHRO of GCC, and the app access will be given to my 1,000 employees.
Yes.
That is number one. And then, my employees, they can go for sometimes free checkup as well. I mean, the first one is free diagnostic test or something. And of course, our vendors, the wellness providers, they do have hospital tie-ups, by the way. And sometimes they do come to our office and conduct some physical activities as well. Okay. And of course, step challenge. I mean, step challenge,
Wonderful.
right? Right? Even we count that 10,000 steps per day, etc. That we do. And what else? Of course, now mindfulness program, right? Sometimes some mindfulness programs. I mean, not repeatedly. I mean, very often we do conduct for our employees.
Yeah.
Anything I missed? I think I
And also, it's cost effective, if I'm not wrong.
I mean, that's very difficult to say. Very difficult to say whether it's cost effective or not. That depends on how much I'm going to get back, right?
Yeah.
How much I'm going to
Now
get
you
the
are
return.
going into the direction that I'm going to answer you.
Okay.
So most of the organizations, as you mentioned today, already have wellness initiatives. Like they are
Correct.
organizing health camps, they are having annual screenings, they are giving yoga sessions, gym subscriptions, awareness webinars. And as you said, that one day they come also, they make them practice some sort of activities and everything, right? It's 1 day or 7 days, correct?
Correct. You are right.
What is after that?
Hmm.
So are we measuring that? So you are very happy seeing that 800 people have joined the webinar, and
Correct.
they are doing the step activity, they are increasing their step activity or something. But what exactly is happening after that? How are you measuring that?
That's a great question. I mean, I'm going up on the ladder, but the ladder itself is on the wrong wall, right?
Yeah.
I mean, that's a good question. Yeah, I mean, we do know the details of the employees who complete maybe 10,000 steps.
Yeah.
And app engagement time we do get. I mean, our HRs they check. And sometimes, even if I ask my vendor, he will send the reports about, how many of my employees they utilized those services. I think those are the parameters we are actually. I mean, HRs are basically focusing on.
Correct.
What else we have to do then?
So we need to ask certain questions. Why don't you ask to your wellness vendors? Rather than checking on like how many people have attended those webinars, why are you not checking with those wellness vendors? Because when you are investing money there, then you should be knowing what is the outcome of those, like where exactly the money is going.
I agree. I mean, you are conveying that, I have to quantify the outcome.
Exactly.
And that outcome is directly related to my insurance claims and productivity, right?
Exactly.
Okay.
Because few questions like, if the healthcare claims are reducing, if the burnouts are reducing, if the productivity is improving, or probably the absenteeism falling or not, or probably are you able to quantify the outcomes?
Yes, I think if you have, say, pre and post, or if you can really identify, say, for example,
transformation.
Transformation. And you can identify, say, for example, out of my, say, 1,000 employees, all are not having problem.
No.
I mean, the well-being programs, what usually as of now provided are for everybody. Right. So you mean to say that if we identify the employees having the health risks, maybe metabolic, I mean, obesity, or maybe pre-diabetes or even diabetes, and many of the employees, they don't know, So that is also there.
Correct.
And if you can address that, so that actually addresses the problem then.
Correct.
Correct. So that's what you are right. I mean, 100% right. I mean, if you can really quantify the outcome or the impact, and then we can really, even calculate the unit economics as well.
Yes.
So per day, if you calculate employee cost, how much I really saved
Yeah.
for, for absenteeism.
Correct.
I mean, it makes sense.
Yeah. Yeah.
And even I can even check whether my wellness program, the cost is also, whether it's worth or not.
Of course, because when you are correctly said that your wellness program is for everyone.
Correct.
Right?
Correct.
So you have a 28-year-old fellow also, you have a 35, you have 45, you have 55 years old person also, correct?
Correct.
So if you are giving a program,
Mhm.
it is for everyone. So
Agreed.
say if we are an employee of a company
Mhm.
and I am having certain problem and you are having certain problem,
Mhm.
and if the wellness program is catering to both of us,
Okay.
it is going to be the same.
Yeah. I mean, it's
So
so.
how like both individuals are different, right? We need different, our requirement, our needs are different, right?
Okay.
Our health parameters are different.
Okay.
Then how the solution is same? It cannot be, right?
So it has to be customized or tailor-made
Of
is
course.
what you are.
Of course.
So if I mean, correct me if I'm wrong. So what you are trying to convey is that one, you have to identify the health risks, identify the health risks among say 1,000 employees or in a GCC setup, and then you have to segregate. Correct. I mean, segregate, identify what program really suits for Sateesh and for another young boy, or
That's
maybe
true.
having obesity, having obesity.
Yes.
And then what? I mean, so we can,
So our approach should be individualized. So if we are identifying, then we will give them an app where everything will be tracked. Okay, it's not only tracked, it is going to get better for them because they will be more accountable because of the support.
Okay.
So there has to be a support. It is going to be AI, but there has to be a human support also.
Okay.
Because a human being only can understand a human being's requirement. Correct?
Okay.
So that support will help that person to feel better, to get better.
Okay, so this is the third point then. I mean, you are mentioning about the third point.
Okay.
So you identified, you detected, you identified on or stratification of the health risks you have done. Sateesh is in maybe green zone or something. You already identified. And then the third point is that so you have to tailor make or handhold the employee so that he can achieve the targeted results.
Of course, yes.
Right.
That is how HabitNu approaches.
Oh, okay. 1 minute. I mean, so now, see, usually, the HR heads, they ask this question.
Okay.
Every wellness vendor he says he is special. Right? He is special. He is very unique.
Yeah.
Very unique. I mean, everybody says my method is unique.
Yes.
I'm really good. I'm great, etc. No, you tell me.
Yeah.
You tell me how HabitNu is different and how your methodology or maybe your program design and the type of collection of data or type of data you collect and the impact or the outcome you show, how it is different compared to because as I mentioned, everybody says I am unique.
So HabitNu approach is actually unique. So the thing is, first you have to know what HabitNu is.
Okay.
So HabitNu is a US-based digital health company with CDC recognized lifestyle change program, and it's helping individuals with chronic stress and prevent and manage chronic conditions. It's not only stress, but they're preventing or managing chronic conditions.
Okay.
And it is happening through personalized coaching and continuous support and evidence-based behavioral support.
So that is why HabitNu,
yes,
new habit, correct?
correct.
So since it is changing the way we live,
Correct.
the habits we incorporate.
Yes.
So
So basically, the science says that
Mhm.
you change habits in 21 days. So you build a new habit in 21 days. Or whatever the habit that you've been following, it changes in 21 days. So that first 21 days, when you are learning something new, you need someone to handhold. You need someone to to make you accountable for it. You need someone who will help you in going there, in getting there, in reaching that particular step. So that support HabitNu gives.
So that means it's not transactional in the sense, in
Of
the sense,
course.
for example, I'm an employee, I join your program. So it's not that, just touch based or transactional. I took your app and, downloaded, and
It's
then
not transactional.
I checked your videos.
Yeah.
And I counted my steps, not like that. So it's transformational then.
Correct.
It's a long-term impact then.
And we are not vendors.
Oh, okay.
We are a company who.
You are a partner then. I mean, you are always
we are correct. We are partners. We are, touching somebody's health. We are transforming their life. So in that case, we don't want to be called as a vendor.
That's no. That's I completely agree. I mean, partner is the one who really joins hands with you, understand your problem,
correct,
and helps you to achieve the results.
Exactly.
Right. That's why there is a difference between vendor and partner. And partner is more of long-term thing. In fact.
Correct.
So, Ishita, I think this is pretty interesting, and I'm sure a couple of participants may be having some questions. Over to you, Ishita.
All right, thank you. So before we go ahead with taking up any questions, before we open it up, quick thank you to Sateesh and Debasree for walking us, through this entire process. Quick summary while you guys are gathering your questions. What we've kind of established with both of them is essentially that HRs and CXOs in this current space of wellness seem to be having a huge gap, in infrastructure between detection. Detection is happening, but the action is not happening. That's where the fault lies, and that's where behavioral change kind of misses its part. Right. So this seems not to be an engagement problem, like both Debasree and Sateesh have said. It seemed to be a fundamental design or a architectural problem. Right. So wellness programs create awareness, no doubt, but HabitNu creates that change. And that's kind of the most important part when it comes to healthcare costs, retention, and work performance. Right. So the organizations that lead tomorrow will invest in protecting performance measurably and personally. Right. So with that, we'd love to open it up to the audience. If you'll have any questions, more than happy to answer it for you. Let's give them a minute. I have a question on the chat. One moment. Priya, do you have a question?
Yes.
Go ahead.
So I would like to ask, as you said, it's personalized coaching also. And when it comes to an organization which is very big in terms of employee number, like 800,000 or plus there, how is this one-on-one coaching really work? Is it scalable with your program?
Take the question.
Yes, I'll take the question. So the thing is, when we are definitely, as you mentioned, that when if we have 1,000 plus employees coming in, then definitely, as we mentioned before, as I mentioned before, that HabitNu program is not for everyone. It is for those people who are at risk, and for the program when it starts. The coaching starts with a group coaching, definitely, where we address the problems which come in general. But when it comes to at-risk, participants or at-risk employees, there we come in the picture where one-on-one consultations we give. So in that case, those at-risk group will be addressed in a one-on-one consultation. And when it comes to a group where people are not really at risk, but they have joined the program because they want to know something more about their health and the metabolic disorders or something related to the habit change or something, then we will have a group coaching where set of 20, 25, participants will be there, or the employees will be added in some one cohort, and then the group coaching will happen. And when whoever wants to have a one-on-one consultation or at-risk group, as I mentioned, those will be taken up by the coach on one-on-one basis. So yeah.
So you are
if that
saying like
answers.
it is not same for everyone. So it's scalable because it's not same for everyone. Am I right?
No,
Like,
no, definitely not. It is not same for everyone, as I mentioned before as well, that HabitNu approaches in a very different way, because every program is tailor-made to somebody's need. So, which is why it's not for everyone. It's not for mass, but it's for those people who are at risk.
Okay. I got the answer that I was I was doubtful about. That's great.
Ishita, any more questions?
Yeah, we have one in the chat box. This is a very interesting one, Sateesh. How are you
Mhm.
different from other one-on-one wellness programs that are used in the corporate wellness industry today?
Okay, I think this question, repeatedly asked by various HR heads or total rewards heads. In fact, a couple of very important thing. One is, as Debasree already mentioned, it's not for everybody. It is for HabitNu program is for the employees whose health risk is identified. Okay, so let me answer the questions one by one. So one is, it is already identified, or the due diligence is already done by CDC, Center for Diabetes Control and Prevention of US. So they have already done the due diligence and identified HabitNu as their partner to impart lifestyle change program, wellness program across US. And we work with more than 150 organizations. So it is science-based. It's completely science-based. One is it's already time-tested, as well as approved by the well-known authorities from US. That is number one. Two, more than 150 odd organizations across the globe are using HabitNu program. Third, as I mentioned, it is basically, we are impact oriented. We are meticulous. So you can really quantify the health data or the results, outcomes with, you can even relate with business outcomes as well. And being a HR head, you can really look into the data, what exactly is happening. Any day, you can look at the data. You will get a detailed dashboard as well, so that you can look at the data, what your employees are doing, whether their health is really improving, right? So, and then it is very easy for you to cross-check whether those employees are, their absenteeism is really, decreasing. That you can really check. You can compare impact. So that is another one. And the next one is, it is more tailor-made. It is customized. It is not for, it is not, the same program or same, the training program or insights, the guidance, the coaching. So those are more tailor-made. Apart from all these things, we use a lot of technology as well. One is human intervention or human interaction, as Debasree mentioned. That is our core thing. However, we do have a lot of AI and data analysis, in fact. So, for example, we have something called Journey Twin. So Sateesh joins for the program, and based on my data, based on my age, gender, geographical data, and behavioral data. So you will see another Sateesh Hegde. I mean, basically a journey twin who handholds me to reach my goal. Are you getting my point? In the sense, this is how we are really different. We are specific, science-based. Impact is very, very measurable. You can connect the outcome of the program with your business goals. That is, I mean, you can really see the return on investment. It is very, very clear. The numbers are very clear. So we address the pain points of HR heads and total rewards head. I hope I answered your question.
Yep, seems like. All right, so we did have another question. Someone just raised their hand. I think it was Mrinoy. Am I audible, Mrinoy? Would you like to take the question?
Yes. So just wanted to check how do you identify health risk, and how do you categorize it once you identified it? So I just wanted to check that.
Okay, so
May I take the question? On that.
I'll take the question. So thank you, Mrinoy, for asking the question. I mean, it is very relevant. So we have something called HPOD. Okay, HPOD can it's time tested, well established product that can really cross check various health parameters. So especially as of now, especially in Bangalore, so what we are doing is we are taking the HPOD and planting it in a campus or in a company so that employees can really cross check their health parameters with respect to obesity, with respect to diabetes, pre-diabetes, etc. Obesity parameters can really give you the health risks you have, and then based on that data, we categorize the employees, on various. I mean, it's stratification, right? Stratification on different health risks, in fact. So that we can tailor-made the coaching program or HabitNu complete program. So, and apart from that, we do have other partners so that, say for example, in Delhi, so we do have partners who can really, check the health parameters. Anything else you would like to add?
No, pretty much you covered.
Yeah. Any more questions, Ishita?
So far, no. I think we have been good with time and we have had a very juicy short session. So let's just quickly summarize this and close for the day. All right. So awesome. So final thought, everyone. Thank you so much for coming. Let's just quickly wrap up and say that nothing changes if nothing changes. All right. So if today kind of helped you shift towards what you're thinking about your corporate wellness strategy, we're helping you with the next step. Okay, so HabitNu is running a no-cost health assessment for a limited number of organizations alone. So if you've had enough of good to haves and you're ready to have a must have, two options. You can stay with us on the call now and we can have a deep discussion. Or if you want to talk live, you can always drop your details in the chat or reach out to any of us on LinkedIn, and we'll be more than happy to set up a call. Okay, so thank you everyone. Thank you Sateesh, thank you Debasree, and thank you all for joining.
Thank you.
Thank you so much.
Thank you.